Welcome to HealthWatch, presented by Novant Health. I'm your host, June Baker. Our show features local physicians and health professionals discussing health topics of importance to local residents. Today we will talk with Angie Fisher, the Director of Clinical Improvement at Novant Health Brunswick Medical Center, and she'll talk to us about the flu season this year. Then we'll meet Dr. Jonathan Lamphere, a gastroenterologist who recently joined Novant Health. Finally, we'll talk with Christy Williamson and Victoria Humphrey about the 2015 Brunswick Beacon Health Expo. Stay tuned to learn about valuable health topics with HealthWatch. Our first guest today is Angie Fisher, Director of Clinical Improvement at Novant Health Brunswick Medical Center. Well, hey Angie, welcome back to the show.
Thank you. It's good to be here.
Now, I know you've been here before, so you're an old hand at this, but let's remind our viewers about who Angie Fisher is and what you do and a little bit about your background.
Sure. Well, I've been at Novant Health Brunswick Medical Center for it's almost 17 years now. Started out in the emergency department and then did the operating room before I moved to administration. And I've been there probably 10 years in this particular role. And as far as my background, I have an associate degree in nursing, then I got my bachelor's degree, and I have a master's in healthcare administration.
Wow. That's a lot of education, Ange.
It takes a lot of training, I guess.
Yeah, it sure does. You mentioned that you'd been at the medical center, 17 years?
17
Boy, so you've
years.
seen a lot of changes.
Lots and lots of changes.
Yeah.
New hospital, but lots and lots of changes.
And you briefly said that you'd been in this position for a number of years. And what exactly is your position?
My title is Director of Clinical Improvement, and that honestly encompasses a lot of areas. It includes hospitals' efforts to improve quality. It includes our relationship with government or reporting agencies, regulatory agencies like Joint Commission. So honestly, anything in that kind of umbrella fits under my department or my employees.
That's interesting. It covers a lot of territory,
It does.
though. You have to really be on your toes to make sure that everything's
We
done
do
the
our
right
best.
way.
Absolutely.
Well, today we wanted to talk about the flu, of all things, the flu.
Yes.
Have you seen a lot of flu cases this year so far?
We have seen a tremendous increase
Really?
this fall. It's very marked increase probably December 21st, 22nd. We had probably a 50% increase in the number of positive cases, and that's just continuing now into the new year.
Well, I hear a lot of people say, oh, I think I have the flu, or they really have a cold, but they say, I have the flu. What are some of the symptoms of the real flu?
The real flu, you would probably expect a fever, 100 or higher, body aches, chills, probably runny nose, stuffy nose. In kids, you may see nausea, vomiting, diarrhea, that kind of thing. It's very similar to the cold, but honestly, it's the degree of it. How sick are you? It's kind of like the cold is this, the flu's this. So it can be much
the
worse.
symptoms are similar, but
Definitely
much more pronounced with the flu.
Yes.
Well, if somebody thinks they have the flu, I hope they stay away from us, but should they go to an urgent care or the emergency room?
Well, honestly, between the two, your most urgent cares are very well qualified to take care of a patient with the flu. If you had other underlying illnesses, emphysema, COPD, you may have special circumstances that would need an emergency department, but by and large, an urgent care, your physician's office, they're going to be able to take great care of you.
That's good information. I think sometimes we run to the emergency room too quickly.
Absolutely.
Maybe, and urgent cares do a great job, but of course everybody really needs that primary care physician.
Oh, absolutely. Absolutely.
Well, how about other resources? Are there other resources available to folks who have questions?
Absolutely. One of the great things that we offer now at Novant Health is the Care Line. Care Now is what it's called. And that's a phone number. It's 910-721-2273. And you can call there, actually speak to a nurse, and they will actually help you figure out, where do I need to go? Do I need to go to the emergency department? Do I need to go to an urgent care? They'll even call ahead and let them know you're coming. They can help, if you're going to a Novant physician, they can help make an appointment. So it's an awesome service. Again, it's Care Now, and that'd be the first thing I'd think of.
And it's free?
Yes. It's totally free.
Oh, that's awesome.
So it is. And they can help you sort through a lot of questions and navigate what you need.
Wow, that's great. I really like that.
Got that on my refrigerator. Absolutely.
Oh, good. Lately, I've been seeing folks out in public, like in stores and what have you, and they'll have a mask on. Is that a good way to stay healthy? And what other tricks can you provide us to?
Well, honestly, my recommendation would be, if you're sick, stay home. For your sake, for other people that you're around. But, if you absolutely have to go out, maybe a mask is okay. But rest, lots of fluids. I can't stress enough the importance of hand hygiene. Washing your hands, covering your cough, all those symptoms, those signs that we see are perfect. That's what you need to think about.
Okay, well, I'm already healthy. I don't have it. So how can I stay that way? Just wash my hands?
Wash your hands.
Wash your hands, wash your hands.
Wash your hands, wash your hands, wash your hands. Absolutely.
That's like the best thing. Huh?
It is. It absolutely is.
Well, good, because there's no magic pill for not.
No.
Well, I think I heard the other day that the hospital sometimes has flu restrictions. Can you explain a little bit about that to me?
Sure. You're right. Right now, we implemented visitor restrictions starting January 2nd.
January 2nd.
January 2nd at 8 a.m. And we are restricting visitors under 18 years old. And hospitals do that periodically. So yes, we do have that in place right now. Okay.
And how long would the restrictions be in place?
Honestly, it's going to depend on this flu season. We know that based on what we've seen, increase in the number of cases, this is looking like it's going to be a severe flu season. So we will honestly look at that every week, and we will look at, okay, are we still getting lots of cases, or has it dropped off? We're also being mindful of the fact that we know that the strain of flu that we're seeing this year was not covered by the vaccine. And that happens sometimes. It's your best guess. What do we put in the recipe? But
it's like making soup.
It is. It is, and you're kind of guessing. But we know that people who've had the flu had the vaccine. So
wow, that's not encouraging.
I understand.
Are there any exceptions to the restrictions, Angie?
There are. Obviously, if the person is under 18, but they're seeking care, if you need to be cared for, we're going to take care of you. If you're the under 18, but you're the parent of a child that needs care, that's fine. We also would have some circumstances if we're facing an end-of-life situation and you need to be able to say your goodbyes. We're going to work with that and do what we need to do.
Oh, well, that's good to know. There are always exceptions to every rule, but I know you want to make sure that the patients are safe as well as the visitors. So the restrictions are there for a reason.
Right. They're there for both sides, absolutely.
Right. Thanks for being here today, Angie. I look forward to having you back, and we'll talk about something maybe better than the flu.
Sounds good. Thank
Okay,
you.
great. Our next guest is Dr. Jonathan Lamphere, a new gastroenterologist with Novant Health. Welcome to the show today, Dr. Lamphere.
Thank you. Nice
Pleasure
to
to
be here.
meet you.
Thank you for asking me to come over.
Now, I understand that you just recently moved to the area. Is that correct?
That's right.
And where is it that you moved from?
I moved from New Hampshire.
Wow. Is it cold in New Hampshire?
It's 10 degrees today in New Hampshire.
So I'm glad I'm here.
I'm glad I'm here too.
It's kind of cold here, but not that cold. Well, I'm curious, what brought you to this area?
Well, several factors. The weather is a primary
Yeah,
factor. We spend 6 months essentially indoors up in New Hampshire. Last year was a very cold winter, and we've been thinking about this for the last few years, and after the record cold we had last year, we decided this was the year to move south. So here I am.
So here you are. Well, I think you'll find it's a great place to live. The people here are fabulous, and just the lifestyle is awesome. We love it. So let's start by learning a little bit about you, where you went to school, your education, your background, things like that.
I graduated from Boston University, got my MD degree there, and after that we went to Tampa, to the University of South Florida, where I did my internal medicine residency. And I did my gastroenterology fellowship at Emory University, and after that I stayed on for a couple of years and taught.
Wow. Wow. Great background, great education.
Oh, thank you.
Good schools.
Well, I was fortunate.
Yeah, that's awesome. Well, let's talk about the new practice. Now, I understand that it is a brand new practice for Novant. We're just we've just opened up your practice at the beginning of the year. So what is it called?
It's called Novant Gastroenterology.
Novant Health Gastroenterology.
That's correct.
Okay. And where is the practice located?
It's right next to the old hospital, right on 17. It's Doctor's Circle, 6 Doctor's Circle, Suite 5 in Supply.
So that's really convenient there. And there's lots of parking, so I think that patients will find that a great office.
Most people know where that is.
Just about everybody. Well, Supply's not very big, so it's not too hard to find. But that is a very accommodating office. Well, tell me, do you have any specialties or interests that you have in gastroenterology? Is there something you prefer to do?
Well, I'm a general gastroenterologist, which means that I treat basically all GI conditions. My primary focus is on colorectal cancer screening. And screening for complications of reflux disease, such as Barrett's esophagus and esophageal cancer.
Tell me, some folks may not know what a gastroenterologist is. Can you sort of explain that?
Well, we're specialists who treat diseases of the gastrointestinal tract, which is the esophagus, the stomach, the large and small intestine, and the ancillary organs such as the liver or pancreas.
And you talked about disorders. Could you elaborate a little bit more on the disorders that you see and that you treat in your office?
Well, colon cancer continues to be a big problem.
Really?
And it consistently ranks among the most common cancers, right up with breast and lung cancer.
Really?
The prognosis with an early diagnosis is very good. It's a common disease. The average person who has no family or personal risk factors for colon cancer still has a 1 in 20 chance of having colon cancer. So if you went to downtown Wilmington and took 20 people, put them in a room, one of them over their lifetime would have colon cancer.
Really?
So it's imperative that people have a colonoscopy and identify if they're at risk for colon cancer, colon polyps. Polyps are precursor lesions many times to colon cancer. And by identifying and removing the polyp, which can be done at the same time during a colonoscopy, we can prevent that colon cancer. And since colonoscopy has been the gold standard in colorectal cancer screening, colon cancer frequencies and death rates have actually decreased.
Really?
Yes.
That's awesome. Well, how often should a patient have a colonoscopy?
Well, for somebody at average risk, we generally start at 50 years old. And if that patient doesn't have any polyps, then, and the risk factors remain the same, meaning that nobody, no close relative in the family, a parent, sibling, or child has colon cancer or precancerous colon polyps, then that person is considered average risk. And waiting another 10 years for another colonoscopy would be the recommendation. Now, if someone does have polyps or does have a family history of colon cancer, then the intervals are shorter than that. And it really depends on the specific risk factors as far as how often we do colonoscopy for those patients that are at higher risk.
So that's a conversation you would have with your patient and determining how often. And it could be different for several people. I mean,
yes, actually it is.
It might be a year or 3 years or 5 or 10.
That's correct.
Well, that's really good to know. I know colonoscopy is not something that people enjoy having, I guess.
Well, most people are not aware that they're having it.
They don't even know they have
That's right, because they're sedated.
That's a good thing.
Yes, it is.
So you believe in sedation?
Well, the sedation is an important part.
Yes.
We do have people, actually, who request no sedation.
No,
they do.
I can't hardly believe
they
that.
They do. And there are patients that, for whatever reason, decide that they don't want to be sedated, and there are a variety of reasons. But colonoscopy does produce some gaseous distension because we put air into the colon.
Yes.
So most people have a little bit of cramping, but people who request no sedation generally do well. Now, that's the minority of patients. Most people prefer sedation, right?
It's not funny, but it is funny. So what happens if a patient has a colonoscopy and a problem is found? Now, I know you said that if there's a polyp, you can remove it at that time. But if there's more involvement, then might they be scheduled for surgery, or how does that work?
Well, most polyps can be removed endoscopically. There are some polyps based on the size and location and other risk factors that would put the patient at a higher risk for a perforation. And that's not something that we would essentially put patients at risk for, knowing that it's a difficult polyp. In that particular case, and this is a minority of cases, that polyp should be removed by another method. And the most common method would be surgical.
And those surgeries would be performed at Novant Health, Brunswick Medical Center?
Yes, where we have a staff of general gastroenterologists who are very good.
Yes, I know they've recently added a second suite, opened up the second suite. I know they had one, and now they've opened up the second one. So
that's correct.
Great facility there. I believe you do upper endoscopies also?
Yes.
Can you talk to me a little bit about what that entails?
Well, the principle is the same as a colonoscopy. You essentially have a tube with a light and a camera, patient sedated, and this is a rather quick test. It takes about 5 or 10 minutes for an upper endoscopy, and for most colonoscopies, about 15 or 20 minutes. The upper endoscopy looks at the lining of the esophagus, the stomach, and the upper part of the small intestine. And the most common reason to do that is patients who have reflux disease, who've had many years of heartburn, who are at risk for complications such as precancerous lesions, strictures or narrowing of the esophagus. There are some people that develop difficulty swallowing because of narrowing of the esophagus, and that can be treated endoscopically with balloon dilation.
Great. Well, that's great information. I know that we're certainly happy to have a new gastroenterologist in town, and I think that you'll do very well. Again, you said you're located at 6 Doctor Circle.
That's correct.
In Supply, and we'll put the phone number on the bottom of the screen so patients can give you a call. Now, you are accepting new patients,
We are accepting
correct?
new patients, that's
and
correct.
And we pretty much take every insurance, correct?
Yes.
So we'll just put that number on the bottom and they can call your office for an appointment.
Very good.
Well, thank you so much for being here. It was a pleasure to meet you.
Thank you for having me.
And I look forward to seeing you again. We can talk about something maybe more fun.
More fun than a colonoscopy? I don't think so.
You're so funny. Our last guests today are Christy Williamson and Victoria Humphrey, here to talk about the 2015 Brunswick Beacon Health Expo. Welcome to the show today, Christy and Victoria.
Thank you.
Thank you.
It's a pleasure to have you here. We're always glad to see you, so it must be the Brunswick Beacon Health Fair time, right?
It's that time of year again.
Well, first of all, let's tell our audience who we are. Christy, let's start with you.
My name is Christy Williamson. I work at the Brunswick Beacon, been there all of 15 years.
Wow, that's a long time.
I am an advertising representative, and I'm also our special events coordinator.
Oh, and you do a great job at that.
Well, thank
we
you.
love the Brunswick Beacon.
And we love you.
Victoria, tell us about yourself. Tell us what you do.
Yeah, I am the Community Engagement Specialist at Novant Health Brunswick Medical Center, so I help to plan and coordinate community relations programs for the hospital. I also support our hospital foundation, and I support our Human Resources Office.
Great. You sound like a busy lady.
Yes.
Well, today, like I said, we're here to talk about the Brunswick Beacon Health Expo, and that's coming up in February, correct?
February 28th.
February 28th. And where is it this year, Christy?
It is going to be at Schlote Middle School again. We did that last year for the first time. It was at Schlote Middle School for the first year last year, and it was a really good, easy, accessible place for our vendors as well as our patrons. So we really enjoyed having it there, so doing that again this year.
Yeah, it was very nice last year. I really like that venue. It works out very nice.
I liked it as well.
Yeah. Well, tell me, what are we offering at the event this year?
Well, this is the 11th year.
Wow.
So we've been working together for a long time, June. But the 11th year, and we have lots of returning vendors as well as several new ones. So there is something for everyone there. Anything from babies to the older generation. So we're going to have lots of free screenings. We're going to have the medication disposal. So you can bring in anything over the counter or prescriptions. No questions asked, just drop it off, and we can safely have it removed and disposed of. But we'll have screenings, anything from blood pressure screenings to glucose screenings, bone density screenings, all types. Everything you can imagine.
And who can attend this event? Like just
Everyone.
Anybody that can hear this, right?
Everyone, if you're listening, please come. Is
it free?
It is free for everyone. Everything that's inside of these doors will be free. So, just come in, and we have little forms at the front that you get to walk around and fill out all of the results for your screenings. So that way you can follow up with your own personal physician once you find out what your results are.
What are the hours for the expo?
It's from 9 a.m. to 2 p.m.
9 to 2. Okay, great. Well, I hope we have good weather and you have a great turnout.
Me too. I'm excited.
Victoria, I know that Brunswick Medical Center is participating in the event this year. So tell me a little bit about what we'll see from Novant Health.
Okay, so Novant Health will be the presenting sponsor again for the 2015 Brunswick Beacon Health Expo. Yeah. So we will have lots of information on our hospital services. We will also have a big representation from our physician practices. We will have the Remarkable You screenings there again this year. We will also have our mobile mammography coach, which is something new, and we'll be doing a few seminars as well.
Tell me more about that mobile mammography. How does that work?
Yeah, so that's new to us this year. It is funded through our foundation. We have it a few days out of each month, and we share it with Novant Health Rowan Medical Center. And it has state-of-the-art digital mammography. It has we have expert female technologists that come on the coach wherever it goes, and it has the luxury and privacy of being in a traditional imaging center. So we will have that, and it will be at the event, and women can come and get their mammogram.
What if somebody needs financial assistance for mammography? How does that work?
Okay, so if they don't have insurance, they can apply to Charity Care, and if they qualify for that, then it will be covered that way. If they don't have insurance and they don't qualify for Charity Care, then we do have foundation dollars that will cover that expense. And of course, if they are insured, then we will just file it accordingly that way. So, yeah.
And all that will be done at that time when they enter the coach? It'll all be done then, is that correct?
That's correct.
Wow, that's a great thing.
It is. It's a great time to go ahead and come out and get that done for the year.
Absolutely. I'm curious, can folks make appointments prior to the event for the mobile mammography?
Yes, and we actually recommend that you do make an appointment prior to the event. Because the appointment takes about 15 to 20 minutes, those spaces are going to fill up quick.
They will.
So we recommend calling our radiology department, which is 910-721-1485.
1485.
Yep, so if you call them, you can go ahead and schedule yourself for that date for the Brunswick Beacon Health Expo, because those spaces probably are going to fill up pretty quickly.
I bet they are. I bet they are, because that's a real savings for some people,
It is. It's very convenient.
Yeah, it's very convenient. We'll be right there, and that's awesome. Well, what other kinds of screenings will be offered by Novant Health at the expo?
Yeah, so we're going to do our Remarkable Use screenings.
And what is that?
So those consist of, we do height, weight measurements, BMI, blood pressure check, and then an A1C blood sugar glucose test, which is like a snapshot of someone's blood sugar. So you don't have to fast before you come or anything like that. But we have health and wellness partners that will talk with the folks that are getting screened and give them those measurements and let them know, if their range is not normal, how to fix that and how to lead a little bit more healthy lifestyle. Yeah.
Wow, that's great. I think there's going to be several Novant practices there. Can you talk a little bit about that?
Correct, yeah. Like I said, we will have a large representation from our physician groups. So we have 3 new practices that will be there this year that weren't there last year. We have Novant Health Seaside Family Medicine. We have Novant Health Plastic Surgery, Novant Health Gastroenterology. Those are all of our new ones. Of course, we'll have Novant Health Oceanside, Charlotte, Bolivia, and Southport. They will all be represented for the family medicine side, and we will also have our surgical associates, our OBGYN office, and I'm sure our urology office will be there also.
And are they all wearing purple? Or
yeah.
aubergine?
We're going to make them all wear aubergine.
Well, good. They'll certainly stand out.
Yeah.
Well, I know last year we had some seminars that were ongoing during the event. Will we have those to offer this year?
We will. We'll have a few. One that I can talk about right now, Dr. Lamphiere, our new gastroenterologist, he will be there to do colorectal cancer screening seminar. So he's going to be doing that, and then he'll also be at the booth to talk to people that are coming into the event. So
that's great. He was on our show today.
Yeah.
He was one of our first guests, and so and I so enjoyed meeting him. So that'll be great to have him talk. He's very personable, so it'd be great to have him talk at the event. I think that's a great thing. So tell me a little bit more about the seminars or the special presentations. Are those at a certain time? Will it be in the newspaper?
We have time slots that are set up throughout the day. We have not put which seminars are going to be at which times yet, but if you check your Beacon Weekly, you will see that when the seminars are, who they're going to be given by, and what the topics are going to be, as well as we'll also have listings of the different screenings that are going to be available throughout the day.
All be in. And when will that information start running in the Beacon?
That information is currently being run in promotional ads in the paper each week, and we also have a promotional supplement that comes out the week of the event. In there will be a map. It'll have a listing of all of the vendors and where you can find the vendors that you're looking for, as well as a listing of all of the seminars, all of the screenings, all of the special events that we have going on throughout the day.
I know that last year it was very well attended. What are your expectations for this year?
I expect it to be bigger and better every year. So I look forward to seeing everyone that has come in the past and look forward to seeing lots of new faces.
Well, great. I think we've about covered it all. Would you like to add anything, Victoria?
I don't think so. We're just excited. We hope everyone comes out. This is a great opportunity to take advantage of, to come and get these screenings, and they're free, and it's just going to be a great time. So tell everyone, and we hope to see you there.
February 28th, Charlotte Middle School from 9 to 2. And if anyone has any questions about anything, they can feel free to call me at the Beacon.
Oh, that's awesome.
910-754-6890. And my name is Christy Williamson. So feel free to give me a call with any questions.
That's awesome. Thanks for doing that, Christy.
Yeah.
Thank you for tuning in to ATMC TV's HealthWatch. I hope this information was beneficial for you and your family. If you have any questions or topics that you would like to see discussed on a future show, please email them to atmctv@atmc.coop. Please visit NovantHealth.org for more information on Novant Health Brunswick Medical Center, local physicians, and general health information. Thanks again for joining us today. Be sure to join us next time for Health Watch on ATMC TV.